Healthcare workers in K Clinic, which is where I'm standing, you'll see behind me, they say that they fear for their lives, especially when they come to work, mainly because they get hijacked, sometimes robbed. Let me speak to PSA, who is one of the representatives in this clinic. And Umlazi, this is concerning. What is the latest, let's say latest experience that they've had where this crime has affected the healthcare workers?
So we came to visit as PSA in the province. Yesterday we received the news that one of the UKZN vehicle was hijacked and stolen inside the clinic. It's really concerning because our members are really afraid to report for duty. We have discussed some of these concerns around Umlazi areas where mobile clinics are being hijacked. That include its K, H and L clinics that are mostly affected.
And when you talk about this crime, this affects, of course, the healthcare workers, people that we're supposed to see assisting the community. We've seen it also in ambulances. Does this also refers to them as well?
Yes, it has a negative impact because obviously the healthcare facilities should be a place of safety where people will be able to get assistance. As we speak, the manager of the clinic was unable to report for duty yesterday because she's under the serious trauma. As I've indicated, that if you look at L Clinic, for example, they have to go to Prince Msheni to drop off their cars and get an alternative transport. That's why we are saying the Premier must be able to work together with the department and also the provincial commissioner so that we deal with this type of criminals.
And we spoke about robbery. What kind of robbery happens here? We understand it's at gunpoint as well.
Yes, it is a gunpoint in the past 3 years. More than 3 to 5 cars that are affected as a result. So the staff are uncomfortable to report for duty. Obviously, even the communities who are coming to source services in the institution, they lose their belonging. You know, they lose cell phones, they lose their money, all their belongings are being taken away. As a result, some of these members are now want to relocate outside of Umlazi. Then you're going to have a problem where healthcare workers are refusing to come in. We also have received the news that the doctors used to come more than 2 times per week in this hospital to be able to assist. Doctors are afraid. In the past 6 months, doctors are no longer visiting some of these clinics.
And just briefly, have you spoken to the SAPS about this?
So we make an arrangement to engage with the provincial commission because as PSA we want to see what will be the strategy. But we understand that this is not only the responsibility of the police, the communities, the councillors, the metro, everyone. Let's make health facilities more safer because imagine if they now need to be escorted to increase the security guard instead of increasing the appointment of the staff. So we hopefully that the provincial commissioner will be able to respond. The Premier, we have engaged the MEC. The MEC share the same sentiment that we must attend to these issues as a matter of urgency.
Thank you very much for speaking to us. That is Nqobile. He is the spokesperson for PSA in KwaZulu-Natal, just talking about the issues that are faced by healthcare workers in these healthcare centers, especially when it comes to crime. For Newzroom Afrika on channel 405, I am Madlala in Durban, in Umlazi.